Hey, everyone.
All right. So Amy's going to tell us today a little bit about Memorial Hermann. She's going to tell us about how all of these stories came together that I introduced. And this is, like I said, this is what it really becomes all about. When we look for ways that companies can see value and benefits from these solutions, it's this way. So Amy, why don't you tell us about what happened in 2017?
All right. So Houston, Texas, Gulf Coast. Memorial Hermann has about 26,000 employees and about 6,000 affiliated physicians. We have over 300 facilities in the greater Houston area, including 19 hospitals, which include the world-famous Texas Medical Center and TIR, the Texas Institute for Rehabilitation. So we are well known, and we're spread out geographically dramatically. So the first question was, who are we? And we are individuals who are across this geographic area that goes much larger than the area we're standing in San Francisco. Houston is the 4th largest city. Very quickly will become the 3rd largest city in the United States.
It's a lot of people.
It is a lot of people.
And a lot of geography.
Mm-hmm.
Okay. So tell us a little bit more about how you were preparing to do an adoption launch for your rollout of Connections, and how that was, I don't want to say impacted, but how maybe that got sped up a little bit when Hurricane Harvey hit.
So we had just upgraded to version 5.5 of Connections right before Harvey, and we were very excited. We now had external access, and the mobile app was turned on. So we were planning, how are we going to launch this? How are we going to drive adoption to our site? And one of the things I'll tell you is that our plans completely came to a halt because we were about to build a DR site for Connections when the storm hit. And suddenly we were frozen. We were all at home watching 54 inches of rain drop on our city. So as you can imagine, we were all islands. And there was, the odd thing about this hurricane is it wasn't a wind event, it was a water event. So we couldn't get to our facilities. Our employees couldn't get to their facility they worked at. Many of them had been evacuated or were stuck at home, maybe on the 2nd floor of their home. Or maybe they had been boated out and they were nowhere. They were just in limbo. So a lot was happening to our employees and our physicians across the area, as well as our hospitals stood as islands where we couldn't get in and out of them.
Imagine that, islands of hospitals and facilities and clinical facilities that clinicians had to get to as well, and doctors needed to get to. So how did you handle that?
So my CIO called me up and said, where do you live? Could you get here? I'm like, no. But I have internet and I have electricity. I'm here for you.
Unless I'm coming by kayak.
Exactly.
Right. Okay.
And we do have some nurses that did get to work on kayaks. What we did was we started to talk through what do we need to do. The first emergency we had was how do we communicate? Our facilities needed supplies, and how were we going to gather the information? We very quickly spun up a Connections community for all our facilities to report twice daily. What did they need? Blood, medication, doctors to perform surgeries, to deliver babies. We used our Life Flight helicopter fleet to move all these things around.
And how did you know where they needed to go? And how did they know where they needed to go?
Through Connections.
Through Connections. So as they were preparing to do an enterprise adoption, if you will, Hurricane Harvey hits. Now you're all on islands. You need to move critical blood and materials that doctors needed in the field. And you had to do that by helicopter, and you used Connections to do that.
There was no other way to get there except by our fleet of helicopters. Thankfully, we had it. And the water did not recede for days.
For days. And usually what happens in a hurricane, if people don't live in this environment where unfortunately you get to know what happens in a hurricane, you know, the water comes in, and there's storm surge, and then the water recedes. And sometimes it's not super quick, but it is fairly quick. But in the case of Hurricane Harvey, you know, that did not happen for weeks.
Houston was actually hit by Hurricane Harvey 3 times.
Yeah.
So it kept coming back. So not only did we have the story about connecting our people to tell us what we needed to fulfill, we connected our employees. So if you can imagine, suddenly you're not in your home. and you don't know how to contact your employer, you don't know what's going on. You need a device to get you connected. Well, before we had connections, there was no way except our external email, and that was it. So we actually spun up a community for our employees to communicate, find out what information they need to know about the status of the facilities, the status of, what do you do in this circumstance? So that was one of the communities we created. We also put one together where people could reach out to each other. So I might live in Sugar Land and I'm high and dry, and I may have a colleague that needs some help that's just a neighborhood over, that I could offer them a ride to work. I could offer them supplies that they may need. One of the other really cool things was the way people found out where people needed help. We had a nurse say, I don't even know where to begin. And all of a sudden her CEO of her hospital and many of those employees came and helped her tie out, cut away the sheetrock in her home. That was just amazing.
It is amazing. Cut out the sheetrock in her home. I mean, this is people's lives and people's homes. And what happens when hurricanes and flooding like this happens is that the sheetrock in your home molds. And so that creates a whole nother level of problems and issues that we ultimately have. So the fact that you were able to use connections to connect people and communicate with people, and that get people to come help not only with the flooding, but also repairs that needed to be handled immediately, I think is such a powerful story. It's, like I said, it's heartwarming because of where I live, and I'm gonna think about this always. So what's next for Memorial Hermann? What is your path for connections? Tell us about iGenerate.
Well, so before I say that, I have to thank my IBM support system. They helped us keep connections, our portal, and same time running, because we were all remote. We were relying on connections like we never had before, and connections adoption was very early. So thank you so much to people like Chris Viega, who came to our rescue, who wanted to fly down, but we're like, you can't. But I appreciate my client exec, Mentai Sua. So I just have to give a shout out to them. And also an appreciation to, we got an IBM grant from the foundation to build our DR site, because the week Harvey hit, we were about to build that.
Right.
So our next steps, one of the cool things about the adoption was people were familiar with connections, and so now we were going to try something new. We were going to ask people for ideas to how to improve patient care, how to save money, how to make Memorial Hermann a better company. And people were submitting ideas that are saving us millions of dollars. So it's pretty impressive.
That is impressive. So, so did you want to talk about iGenerate?
That is iGenerate.
That is
so
iGenerate,
iGenerate
okay.
gives individuals the opportunity to submit an idea, give some detail, and then groups go through those ideas and determine, can we implement them. When we began the project, it was a little bit slow, but we gained some adoption of that idea, and people were beginning to submit ideas that are turning into million-dollar ideas.
Million-dollar ideas, and people are voting on them.
They
Through
are voting
ideation
on
blogs.
them. We have a couple of patents, but I can't talk about those ideas.
I love it. I love it. So, Amy, I want to thank you for coming today and telling us your story. This is just a tremendous amount of work that you guys have done to not only help the people in time of need, but also to make sure that your company really understands that this is, very important from a communication perspective, connecting people. And in times of tragedy, where these tools become the foundation, and they can, get put up quickly if you need them. That to me is a very valuable story, and hopefully very worthwhile to Memorial Hermann. So
and hopefully that within 6 months, SharePoint will be dead at Memorial Hermann.
Well, I like that. Woo! Awesome.